All right, I think we could probably get started in respect for those people that have signed on at 7 o'clock. So thank you all for being here. We do really appreciate you taking the time to get some information from us tonight. It's been about 5 months, I think, since we made the very, very difficult decision to close the temple. And when it became clear that it wasn't going to be opening soon, we weren't going to be reopening soon, we put together a task force to evaluate those things that we needed to do. And we chose several people from our congregation we felt were has some expertise and knowledge in this area to help us make a really good decision. And our priority during this whole time has been to make good decisions, in regard to safety for our congregation. And it's been the philosophy of the task force to err on the side of caution. We would much rather open maybe a tad too late than too soon. So that's been our priority. And I think what I'm going to do now is turn it over to Eric to introduce the various members of our task force.
Thanks, Steve. So as Steve mentioned, we really tried to create a task force with some expertise, both in the medical field, as well as management, and as well as knowledge of schools and education. The task force consists of Marcia El-Cumbre-Centino. She is a doctor. She's going to be actually giving our first presentation when we come back to that regarding what's going on with COVID here in Long Beach and in Los Angeles County. We also have Marion Martin, who is a business owner and also a Torah Center teacher. Susie Amster, who is a retired executive director extraordinaire for synagogues for many, many years. We have Carl Schultz, also a doctor and very involved in the Orange County process of what's going on with the COVID response there, and he'll give a presentation as well. David Tillman, retired doctor and also a specialist in infectious diseases and medicine. Glenn Newman, also another doctor and family practice physician in Los Angeles, and Greg Endelman, who is a vice principal for a school in Orange County. So we thank all of our task force members for joining us for this call this evening and being here to answer questions that you may have. And we're going to turn it over to Marcia for an update about what's going on here in Long Beach and around Los Angeles. So.
Okay, hi, welcome everyone. I'm Marcia El-Cumbre-Centino, and I am an infectious disease doctor. I work at St. Mary Medical Center at the CARE Clinic, which is actually HIV AIDS clinic, but I am infectious disease trained, and so I was asked to be on the task force to help as far as the infectious disease input. And what I was going to do tonight was go over some of the Los Angeles County and then Long Beach data that we have so far on where we are with COVID. So Eric, you've got slides, and I don't know how well these are going to all project, but we'll try, and then hopefully that I can explain them. So so if you go to the next one. Okay, so this is, so LA County, they published on their website their daily COVID data. As I think many people know, that as a disclaimer, that there was a backlog of cases in the California data reporting system, which then reflects both the county level and the city level data. So we put that disclaimer in as far as that as those backlog of cases catch up, we may see some of this data change as the as those are caught up. But this otherwise is data as of August 15th. On August 15th in LA County total, there were 2,103 new cases reported for that day. And that was bringing to a total, a number of cases of 220,762. So if you look at that number of 220,000 positive cases in all of Los Angeles County, that's out of about 2 million tested tests that were run. And so what's called the test positivity rate is about 200,000 over about 2 million. So that's approximately 10%. So that's where overall the LA County had been running. And we want to see that number come down. The goals, different states have different goals. California definitely wants that rate down below 8%. And it probably should even be lower for us to start feeling safe about reopening. New deaths in Los Angeles that were reported were 35 that day, and then the total deaths were 5,245 within LA County. Okay, can you go to the next one? So this is just showing the cumulative cases. So again, where these totals come from. So if you see this huge increase from in July and August, especially, and that light blue color is up over the 200,000 mark. And then the small dark blue number at the bottom is the cumulative number of deaths. So, and then the case fatality rate is the percentage on the side right, and that's looking now about 2%. So of all the people who do test positive, that small percentage is the rate at which there are deaths. So we've improved in the death rate, which is good news for the county. So that's what that graph part is showing. But it's just to give you an idea of how it exploded over July and August. So the next slide is showing this by daily cases. And so here's where the good news is starting to come in. So if you look at all the thin light blue lines, those are the daily cases. And so you can really see that peak into July, and after 4th of July is, we saw all that peak of cases. And now it's really been coming down. And so if you look more into August, you see that the numbers daily are coming down. So that is giving us good news that we're starting to see a decrease in the numbers that we're actually seeing on a day-to-day basis. Okay, the next one. So this is looking at the 7-day positivity rate. So when we looked before at like our overall cumulative positivity rate, that was around 10%. But again, those peaks were in the end of June and into more of July. But over the last week or two in LA County, you can see at the far right that it's starting to decrease. So that's looking at just over a 7-day period, what's the positivity rate. And so we're starting to see the numbers decline. And so there may be some that there's more testing being done, but even more so, maybe people are listening and, there were more closures again, people are staying home more. And so hopefully that this is a trend that we'll continue to see to decrease. So this was also more optimistic. Next one. And then similarly, the hospitalizations have been going down. So you can also see that trend on the right, that we kind of reached that peak in July, and that it's starting to go down for their hospitalizations. And the kind of target goal is to see that it hasn't increased in over 14 days. So we're working in the right direction. And then I think the last one for LA is, the next slide is the deaths. And again, also the same type of pattern that we're starting to see the number of deaths going down daily as hospitalizations are also going down. So at least we're seeing some improvement in LA County as a whole. So now switching over to Long Beach, if you look at the next slide. In Long Beach, this is from the longbeachcity.gov website. And as many times as I try to get the slides to to save and transfer, I couldn't, so I apologize if it's hard to read this. But basically the number 9,637, that's the total number of cases that have been reported in Long Beach. And the case positivity rate with that is 8.5%. So again, the state goals that are being set are below 8%. So we're getting towards that. We're a little bit below the 10% of the whole LA County. And at the time of this, there were 79 hospitalizations and a cumulative total of 190 deaths. We also, Long Beach tends to report their numbers in terms of rates per 100,000 population. And so right now our case rate per 100,000 population is 231. And the goal would be to have that less than 100. So less than 100 cases per 100,000 people. And if you look at the blue graph, again, that's over time, and just the same point as in LA County, that you see that high peak where it was at on the far right. That peak was the July peak, and then you can see the numbers coming down towards the right of the graph in August. And again, the bottom part of this, it shows the breakdown by zip codes of different areas of Long Beach. And I know this isn't very readable, but if you want to go on their website, then you can look up your zip code and see but different areas of Long Beach. Okay, the next one. So again, about hospitalizations in Long Beach, look at on the bottom. So, well, on the graph on the top, it's showing the city of Long Beach compared to Los Angeles County, and our rates are pretty similar. And the bottom part of the graph is the hospitalizations by actual numbers and per day. And you can again see that they kind of peaked the most in July, and then now to me, this looks very steady. They actually report that this is a -2%, so a little bit of a decrease. And I know at our hospital, our numbers definitely have gone down as far as the number of hospitalizations. And they were averaging around 80 inpatient a day for all of the hospitals in Long Beach. And these numbers vary a little bit because as cases get confirmed or were suspected, but then they are proven to be negative, that's why these lines shift a little bit. But hopefully we'll continue to see these hospitalizations go down. And I think I have one more about the deaths in Long Beach. And so this is, the top graphic is the number, Long Beach is the middle light blue line. So our race is a little bit less than the whole county of Los Angeles for our death rates. And then again, the bottom graph is showing more over time. And so again, we're seeing a decline now in the death rate. So last slide, Eric, is just so in summary, Los Angeles County, we're still seeing approximately 2,000 new cases per day. So we're not out of the woods yet by any means, but at least some of these numbers are improving. Long Beach itself has had 9,637 cases. The test positivity rate for LA County overall has been around 10%, although the average 7-day one is decreasing. Long Beach, we're at 8.5%, and our hospitalizations seem to be stabilizing and our deaths are decreasing. So we're moving in the right direction, and I think that's with a lot of social distancing and mask wearing, and hopefully we'll continue to move in the right direction. That's my summary. I will hand it back to you, Eric.
David or Glenn, do you have anything you want to add about Los Angeles medical situation that you feel like?
I would just say that we have a lot of members from Orange County as well, and the Orange County numbers are pretty similar the way they've been coming down.
Yeah, so Carl is going to actually
talk
a little bit about our Orange County numbers, and we'll head to him,
And I can also say from my perspective, I'm seeing many fewer positive tests in my office lately. I was seeing a lot for a while. We do a lot of screening at my office. Very few positives coming through here anymore in Santa Monica.
And as everyone can see, Glenn is actually at work right now. His report from there. So
right, that's my respirators, my N95. So I'm staying safe.
I do have an added comment, Eric. I think that was a very good summary. Statistics are very important for us to follow, to understand all of these trends and to use some objective data to better understand what's happening. The state is expecting that before they, within quotes, open up a county. Most recently, I just read in the past couple of hours, LA County's positive test rate is only 6% over the past week. Long Beach is 8%, but it had been as high as 14%. And so as Marcia said, things are trending in the right direction. In addition to what is happening in the clinical world, it's also important to know what the state, the county, and the city are requiring of us. And the city has for a couple of months now had requirements that don't allow houses of worship to open indoors at all. That's a little stricter than what the state has put out, but that is what exists in Long Beach. It's still possible to have outdoor meetings, but that's thwarted by the fact that the city is not giving permits for any group meetings at its parks. But again, whatever is happening clinically, and it still is problematic, the city is not allowing churches, mosques, temples to open.
David, and we'll talk about what you just said and how that what that means for the temple in just a little bit.
Great.
Carl, can you give a more detailed just update on what's going on in Orange County? Give more of an introduction of who you are and please as well.
Sure. Yeah, my name is Carl Schultz. I am the EMS Medical Director for Orange County. And while it may not be obvious, the county does rely reasonably heavily on the EMS division agency to support the public health effort. So we're fairly intimately involved in what the county is doing, and they rely on us to help support that effort. So I'm going to give you just a very brief overview of where we are right now. A couple of things that we follow that are very supportive of the direction of the rate of infection is hospitalizations and ICU admissions. And we've had a phenomenal decrease in both of those. The advantage of using hospitalizations is that it's not really reliant on how you test people. So if you get lucky and you test a group of people that all are infected, you get a very high positive rate. If you test a bunch of people that don't have disease, you get a low positive rate, but you really still don't know what's going on. But when you look at hospitalizations and ICU admissions, it tends to give you it's a slower picture, but a more stable picture of exactly what's going on. And in Orange County, we went from a peak of about 700 hospitalized patients with COVID-19 back in July, and we're almost at 400 now. So it's been a huge drop. And the same thing with ICU admissions, from like 240 all the way down to 130. So we're not quite halfway back down to where we started, but it's a phenomenal drop, and it indicates that the disease is not spreading nearly as much in the community as it had been. We do a lot of testing, and we're trying to be more systematic about it so that the numbers we get back mean something, so we can actually make decisions based on it. And while we don't rely on any one number, in totality, it looks like the number of people who are infected is significantly dropping. We're getting close to what would be an actionable number of about 5%. The state says if you're below 8%, you're off the bad boy list, which is nice. But from an epidemiologic perspective, that doesn't necessarily mean that it's safe to go back in the water again. So in looking at what it would take where we could start opening schools and considering other issues, 5% would be a better number. And so that's what we're sort of holding out for, but we're getting there. We're down now to about 6.5%. So we're getting closer. The one area that is still a problem is the skilled nursing facilities. They have not shown the same reduction. It's better there than it was, but it's not so good. So it's sort of a reservoir for where infections can spread. Employees go to work, get infected, then go home and infect other people. And so it continues to sort of be a reservoir for infection, and we're looking at that. I don't know how that's affecting Long Beach, maybe not so much, but at least for Orange County, that's still an issue. But overall, we've made substantial progress, and perhaps within a number of weeks, I can't exactly say how many, but less than more, we would probably be able to start targeting one item, be it schools or be it religious services, to reopen and then to follow. So that's basically where we are. Our population is about 3 million, so we're about a third, more or less, of what's in LA County. But 3 million, that's a sizable number. So I think what we're seeing is real, and it's just not an error of sampling. It means something. So I'm encouraged to hear what's going on in Long Beach. That's certainly consistent with what we're seeing. And I'm optimistic that within a few more weeks, we may be able to get the numbers down where we would like and start taking some action.
Hey, Carl. I'd like to remind anybody who's joining us on Facebook that you can submit a question in the chat. We will take questions. Sharon, is there anything as of yet, or
no questions as of yet?
Regarding the medical overview?
No questions yet.
Okay. So I want to just go back to a bit of what David was talking about and review the, sorry, just looking to, there we go. So right now we are all acting under this this order by the state and by LA County that just so we know we're not arbitrarily keeping people away as well from attending services. There's actually, so in-person religious services and cultural ceremonies are permitted outdoors only at this point. Indoor in-person religious services, in-person services and cultural ceremonies are prohibited here in Long Beach. And so that was the revised order that was given by the Long Beach Health and Human Services. I know as far as the synagogue goes, trying to plan outdoor programming. We've done some drive-bys, but we continue to look into potentially planning some times that we can get together as a community in a safe and outdoor situation. That takes a lot of planning as well. Right now, until those numbers drop, as our medical professionals have said, the reality of opening our facility to services here at the synagogue as well as programming, it doesn't make sense for the health of our members. Also, the task force really considered what we're able to do and working with staff and what we're doing online. And we're really trying to offer as much to our community online as possible. So as long as we are continuing to be successful in that way, it's a general feeling that we want our members, when they come back to the building, we want everyone to be doing so in a healthy way, in a safe way. So as we can plan that, that'll happen. Why don't we, I'm sure many of you are really interested to find out what's going to be the plans for our high holidays and our Torah Center. We have Cantor Haas, who has joined us and is going to give us an update on what the plans are for the temple for the high holidays.
Eric, one moment, just before Cantor Haas begins, there was one question from Mark Dressner wanting to know if anyone's heard anything about Labor Day park or beach closures to prevent large gatherings. And we don't have anyone on the task force that's with the city. I don't know if any of our physicians have heard anything about that.
Marcia, have you heard anything as far as closures?
No, I haven't heard any specific plans about Labor Day as of yet, but I mean, but looking at what they did for 4th of July, they did close the beaches for crowd to help prevent crowds. I haven't heard if they're going to do that again.
Okay.
I don't know in Orange County if you've heard anything.
Carl, have you heard anything for the Orange County?
Yeah, right now they have not issued any orders to close the beaches. That's, as anyone who's followed the news understands, that Orange County it's a touchy subject for the Board of Supervisors. So they have tried to avoid it, I think, as much as possible. And unless somebody really forces the issue, I'm not anticipating that they will do that, especially with the numbers coming down. I know it's like, well, since they're coming down, let's all party. It's like, yeah, and they're going to go back up again. But given the political tenor that exists in Orange County, I at this point do not anticipate that they would close the beaches.
Okay. All right. Mark, thank you for that question. Anything else, Sharon? Any other submitted?
That's all.
Okay. So let's head over to Cantor Haas for an update on what the holidays are going to look like this year.
Erev Tov, everyone. I almost said Shabbat Shalom, but we're not quite there yet. Week just started. It's great to be here tonight. And I want to just first thank this incredible group of lay leaders and staff who really have spent a lot of time thinking about what's best for our community. And I'm grateful and feel very comfortable in your hands of how you've made these decisions. So thank you for committing the time you have to this. It's very much appreciated by not just me, but I know our entire community. So a couple of things for High Holy Days. So High Holy Days will be happening virtually, as we have had services happen. They are going to be happening slightly different. They will be pre-recorded with the music. Well, let me start by saying, I think a lot of people wonder about how are you going to get all the singers, and how are you going to get the feeling of High Holy Days, and how are you going to make it feel like my temple and I can't be there, but I want to be able to feel the community and feel the feelings I have when I'm sitting in my community, in my sanctuary. So I want to start by saying that we have a task force that has been put together to make this all possible. And the goal, myself and Rabbi Fox have together really tried to put together services as they would be in the sanctuary, what we would be experiencing. We are definitely tightening them time-wise, because we know that it's very hard to sit and watch services for a very, very long time, and High Holy Day services certainly can run long. But one of the things that we just did this past week is the music for High Holy Days has been recorded. We have an incredible quartet. For those of you who have been able to see the 4 of our 8 professional singers that we are blessed to have been sent. They are all recording from their own homes, and we have a music, somebody who's going to mix the audio and the piano, and then we have a congregant's daughter, actually, Ronnie Love's daughter, Sushila Love, who is going to be our film editor, creator, who is going to be putting together all of these pieces. There will be live aspects. The beginning of the service will be, Rabbi Fox and I will be welcoming everybody. Rabbi's sermons will all be live. We will not release these videos until the time that we would typically have a service. So on Erev Rosh Hashanah at 7 o'clock, services will start, and they will then be, you will be able to come back to them at another time if you can't be there at 7 or want to relive the experience again. And then, so that'll be Erev Rosh Hashanah morning, Kol Nidre, and then Yom Kippur morning. And in regards to the other aspects of High Holy Days, we're really trying to create as many community experiences as possible. Yes, they'll be virtual, but we're going to be having forums and family experiences, and some semblance of an adventure in the park, or Rosh Hashanah in the park. We will be concluding both Rosh Hashanah and Yom Kippur with Havdalah, like we have been, which has become such a ritual now during this time. And we will be really trying to create a very intimate experience while doing it very safely. We have been taking all precautions. Hasn't been any sort of concern about singing. I'm the only one singing in the space, and everybody else is very far away. We really are trying to do this in a way that is both meaningful, intentional, and for the safety of everybody in this community. And I know that we want to be together, and the goal is that that will happen very soon. But our priority right now, again, is to put our community's health and safety first. And we really, really are working very hard. We have an incredible team. Paul Levitt, who is our sound engineer. We've doctors on on the High Holy Day Task Force, Jerry Levy, Howard Ort, Christina Boatwright, who is a city employee who's been really incredible in just giving us information. So we are, I hope I'm not forgetting anybody else, and Steve Gordon, who of course has been on our task force, and Mark Dressner as well, who is a doctor in Long Beach. But we are really are trying to create an experience that will be meaningful and memorable, and that when you are sitting in your homes, albeit it will be strange, there will be moments of that nostalgic, oh, this is High Holy Days, and this is really what it feels like High Holy Days to us. And so tomorrow we're going to be sending out an email that's going to be coming from the rabbi and myself and the High Holy Day Task Force with the information about the schedule, about the schedule of events throughout the days, through the 10 days of the High Holy Days, and a real sort of explanation and a breakdown of sort of what's going to be happening. So it's a big undertaking, and there's a lot of work to be done, but we really, really are working with your thoughts and and just the love of this community in mind. That's what's keeping us up and keeping us together as we create what I know will be a very beautiful and meaningful experience for the High Holy Days this year. Are there any questions that came up?
Yes, yeah, Cantor, there are a couple of questions. One
Please.
is whether or not we will be having a cellist join us for Kol Nidre.
We absolutely will. Cecilia Tsan will be back. She's actually she's in France until the very end of the month, but she and David are going to come in and be socially distanced and be videoed, and it's yes, absolutely. We wouldn't have High Holy Days without that.
Wonderful. And then there was a question about the possibility of creating a CD or DVD of the High Holy Day services.
Yes, we have talked about that. And the short answer is yes. We are going to figure out the best way to do that, whether it's maybe not, it eventually will be on a CD or a disk drive. We are going to record services, absolutely. So it's a matter of how soon can we create them, because we do know that there are going to be people that, and we recognize that virtual services or technology, it's difficult for some members of our community. And so we are working to figure out ways to bring that to them. So whether it's having someone call ahead of time to help set up their Zoom, or to explain more the technology, or the question of creating a disc, even though it wouldn't be in real time, to have after the fact that they can then still experience High Holy Days. Yes.
Great. And then there's another question from Kathy Krita about programming for Yom Kippur, wanting to know if there'll be things going on all day throughout Yom Kippur.
Yes, that absolutely. Thank you for that question. We will have services in the morning. Once services are over, we will be having a live family service. So similar to how we've been doing our Shabbat morning, our evening and Shabbat morning services. Rabbi Fox and I will lead a family service. And then they'll be going into the forums. So the forums will still be happening. And I know that Mark Dressner is working really hard on those experiences. And then we will then go into a brief Ne'ilah service followed by Havdalah. So the whole day will be filled with lots of opportunities. If you have any, I mean, I may be speaking out of turn when I say, if you have any thoughts or suggestions, I would reach out to Mark Dressner about things. I know he's already got some really exciting things happening, and that information will come out soon as well.
Great. And then there was one more question, Cantor, about the High Holy Day Machzor, what we'll be doing for that.
Yes. So right now, as it stands, we are the first thing is we will be including thankfully the CCAR has been able to, like they have with the Shabbat prayer books, have created a free flip book, meaning that if you're on the site or if you have a tablet and you want to open up the flip book to have in front of you, those are available and being made available for free. We are also going to be including links for those people who would like to purchase those prayer books through the CCAR at a discounted rate, as well as the link to buy. It is also available on Kindle. Right now, we are not 100% sure if we're going to be able to have the words up on the screen at the same time, because as you know, those of you who experience services, like you saw with Marcia's PowerPoint, when you can't see people when you are very well if you have the PowerPoint take up the whole screen. And so we all want to try to see people's faces. We're going to be having readers and we're going to be having different people speaking. And so we are trying to make that happen. But the definite is that the online books will be available as well as purchasing ahead of time. And that information is part of the letter that will be going out tomorrow. I hope that answers. Any other?
Yeah, there was a comment from Mark Dressner just reminding everyone that in addition to the forums and forums on Yom Kippur,
Yes.
that we'll be having programs, forums, and as you said, or Cantor, family experiences during the day on Rosh Hashanah.
Yep.
And Jael Haddock was asking about kids programming for Yom Kippur.
So for sure, we know that the family service will be happening on Yom Kippur afternoon. We are also, again, thinking of other possible family experiences that can take place in the afternoon. I did also forget to mention that in the afternoon on Rosh Hashanah, Tashlich will be attached to, some form of Tashlich will be attached to Havdalah. And we're coming up with our own ritual for Tashlich this year. I also don't want to forget to mention that the teens will be holding a service as well. Sharon, I want to just confirm that is going to be Erev Rosh Hashanah.
Yes, I believe so. And then they're also going to be doing some of their own workshops or experiences on Rosh Hashanah day.
Fantastic, yeah.
But Jay, just to kind of respond to your question, I think you may be alluding to the younger children programs that we've had traditionally had during the morning for Yom Kippur. At this point, we are not planning to have those programs specifically on Yom Kippur morning.
Thank you, Sharon. I also just noticed that Kathy had a question about readers and aliyot. Yes, the answer to that question is, the short answer is yes. We will, because of timing, our Torah service will not be what it usually is in terms of length. At this point, Rabbi Fox and I will be reading Torah, but we will be having readers, and that is all being worked on right now to try and figure out technologically the best way to do that. But yes, the answer is we will be having readers. I mean, the goal is that we want, just like we do in the sanctuary for services, we want congregational participation. And so we are going through the services. Rabbi Fox and I are really kind of trying to go through our outlines and to try to pull out opportunities to make sure that we have those as part of the High Holy Day experience. So please keep a lookout. We will be in touch with people directly. And so there will not be a letter sent out this year because, again, we won't have as many readings available as we would people. This year, we, again, because of timing, we did have to cut down the services tremendously to be able to do everything we want to do, and then also not, we call it, Zoom, what is it? Being zoomed out. Right. We don't want it to become stale. So we are, again, working very hard to make sure that we create opportunities. But yes.
Great. Thank you, Cantor. Is that all for the questions, Sharon?
Yep, that's it for now.
Okay. Great. Well, why don't we move on then with you, Sharon, and why don't you give us an update about what the plans are for Torah Center and starting the year with that?
Wonderful. Thanks so much. And there was just a last minute comment from Jerry Levy reminding everyone that there will also be a shofar choir that I guess will be recorded or somehow done. So stay tuned for more information about that. If you're interested in being part of our shofar choir, feel free to reach out to the temple office or directly to Jerry Levy, who can give you more information about that.
Thank you.
So
I just want to say one quick thing really quickly. I did fail to mention that David York will be is going to be the glue that puts us all together musically. So he is a major part of why this is all working, because David is incredible, and High Holidays for this community would not be what they are without him. And so we are grateful for the work that he has already put in and is continuing to put in. But I didn't want to go without mentioning David and how much work he's doing.
Great. Thank you very much. So Torah Center, I know that there has been a lot of interest about what is happening with education at the temple and really for education in general for all of our children. I am happy to say that we have figured out our plan for the start of Torah Center. I will be sending out all of the details later in the week to Torah Center families, but I'm happy to tell you a little bit about the general plan. And that is that we will be meeting on Sunday mornings for all grade levels, which is a little bit different than we've done in the past. We've had some grade levels meet on other days of the week, but all grade levels will be meeting on Sunday mornings via Zoom. We are planning to, of course, start the year off virtually. And right now, we're working with a tentative plan of being virtual through Thanksgiving. If conditions greatly improve and we really feel safe and confident about returning in person, either in the temple building or in outdoor spaces, we will be excited to consider that option. But in the meantime, just for sort of planning's sake for our families and for our teachers and our students, so they know what to expect, we are saying that we're going to be virtual through Thanksgiving. We will have 2 sessions on Sunday mornings, which will be, again, explained in further detail via email later this week, but it will allow for our students to have some time with grade level instruction, and then other times having family experiences through Hugim and Tefillah. So we're excited. We feel confident about our plan moving forward. All Hebrew instruction will take place midweek in small groups. That was something that was really a silver lining for us in the spring. You know, prior to the COVID shutdown, we have always done Hebrew instruction in large groups, full grade levels, where we would have 15 to 25 kids learning Hebrew at one time with one teacher. And we found in the spring, when we reduced those numbers, that it worked really well, even though the session length was shorter, and it will be shorter in the fall as well. Kids seemed to really do well, and teachers felt really positive about that teaching experience. So we're going to continue that for the fall, where we'll have small group midweek Hebrew with our Hebrew teachers. I'm happy to say that we have the vast majority of our Torah Center teachers returning this year, which makes it an easier transition for the fall. Hopefully the teachers will look familiar to the children, and we're going to be working hard to figure out ways to build community and do our best form of education virtually as possible. We have a teacher conference and teacher training this coming Sunday, which we're looking forward to. And then we'll have additional teacher in services before the school year begins. We are welcoming a couple of new teachers, but not too many. And the new ones that are coming on are very excited. So that is sort of the overview of Torah Center. We're very aware of the fact that our students are going to be spending a lot of time in front of screens for public school and then for Torah Center. So we've tried to design a program that will allow our kids to be in front of the screen for short blocks of time and not have to sit there for many hours during the week.
Thank you, Sharon.
You're welcome. Let me see if there's any questions. Hold on, I couldn't look at both. No questions about Torah Center. So again, if you think of questions or if you have questions as our information comes out this week, please let us know.
And as we move ahead, we're going to be having more and more programming here at the Temple. July was a bit of a quiet month, but we're ramping back up and getting into gear. I know the Joys of Jewish Learning Committee is meeting and putting together their agenda and catalog for the upcoming year. Despite us being still doing all our programming virtually, there should be plenty of opportunities for people to find something that they're interested in, as well as our Touch Shabbats are going to be ramping back up, and youth programming and what have you. So it's looking to, despite being virtual, still be a very exciting beginning of our year as we move ahead with the holidays and beginning of Torah Center as well. I wanted to open it up to any of our other task force members if they had any comments or if they had any questions of the presentations that were made by our professional staff. Anybody on the task force have anything they would like to add as far as things that they experienced or just want to add input to? I don't see anybody. All right. Well, if there are no questions in the chat, Sharon, if there's no.
I'm just looking here. There was a question about slichot. Cantor, I don't know if you can speak to that.
Yes, the answer is yes. There will be slichot. As some of you have experienced in the past, we've done a service and a movie. I believe that those, we have to talk about the movie part, but for sure the service part is happening. We have beautiful books that hopefully we can glean from again and create services, but it'll be very similar to one of our Shabbat services in terms of how they're done on Zoom.
Great. I think those were the only remaining questions, Eric.
Thank you all for joining us. And it's really important discussion and important information about what's going on in our greater community as well as our temple community. Steve, do you want to add anything in the final goodbyes before we end the program?
You're muted, Steve.
Got it. Okay. Again, just want to thank you all for participating in this forum tonight. I want to thank all the panelists for the time that they have spent doing their research and presenting and giving us their expertise for the benefit of our temple. It's really a tough time. Everyone wants to be back. That's really clear. But we want to emphasize, as I said earlier, that we want to do it the right way, and we don't want to make a mistake by coming back too soon. And when we do come back, it's going to be pretty great. It's going to be just as great as it always has been, and there'll be some pretty good meaning, pretty good fulfillment when we do get back all together again. And I'm certainly looking forward to seeing all of you back together. And you know, we just want to promise to you that we're doing all that we can to do the best we can, the safest we can, so that we can all get back here safely and in good spirits. So thanks again, all of you, for joining us, and everyone on the panel as well.
Eric, I'm sorry, there was one more question that came up. Sorry, I know, they don't want us to leave. There was a question about whether or not the temple had considered any kind of parking lot, if we've looked into any kind of parking lot rental for programming or services in the future, either from other churches or schools. So it's just something we may want to look into.
So I know it is something that the staff has discussed as far as possibilities for services and programming. We haven't locked in on any one date or any location just yet. A lot of focus has been on the planning for the high holidays, as well as the planning for Torah Center. But that is in our minds as far as potential plans for locations where we could do things in person, but still at a safe distance. So, and once we plan that, we'll definitely communicate that with our community.
Great. And just in general, Eric, lots of nice thank yous to the task force. So thank you to everybody who's here with us this evening. We certainly could not have done this work without all of your assistance and input.
Appreciation to our task force, like Steve said. We wish everybody a great evening.
Before you go, there was one other thing. Sharon, there have been
I'm
some
say
people
anything else. It's good. Now you guys are
people
going to do it.
asking about Torah Center start dates.
Oh, yes, thank you. The Torah Center is scheduled to start on September 13th, and that is our plan. That's our plan, September 13th for our opening day of Torah Center. Thanks for asking, Mark. So I will show everybody on the task force again, so you can all wave hello, all of our task force members. And I want to thank everyone for joining us this evening. Feel free to keep sharing questions with us, but not right now.
All right.
Good night, everyone.
Thank you for joining us. Good night.
Hey.